Hi, everyone. TJ Alls, I-45 now in Galveston now, and welcome to the special edition of Health Care Unmasked as we take a look back at the year 2022 and what's ahead in 2023. A special guest for us, first time on the show. We're glad to have with us the interim president of UTMB Health. That's Dr. Charles Mouton. Dr. Mouton, welcome. We're glad to have you with us this first time.
Well, thank you. I'm excited to be here, TJ. It's great to be with I-45 now.
And what a year 2022 was. It was kind of like the first year we emerged from everything that was kind of COVID pressures, trying to put some of that behind us, even though COVID is still around with us, but we're not at that extremes as we get into 2023 coming ahead as well. That's still going to be on the forefront of some people's minds, but something we have to really take a challenge to. But as you look back at 2022, reflect on what you see as the biggest achievement you saw from UTMB Health over this past year.
Well, thanks, TJ. I think one of the things that I saw as one of the great things of UTMB was our ability to meet our mission. And that mission is to not only provide health care for our region in the state of Texas, but we also were able to train an outstanding workforce. And we did cutting edge research that actually led to the vaccine development and allowed us to begin to work toward getting this pandemic under control. So that was very proud moments for us at UTMB.
One of the things when we talk about the pandemic is I think there's an area that gets lost in a lot of this, that early on UTMB Health was already long before you were hearing about vaccines even being a possibility or pinpointing a best way to fighting COVID-19, that UTMB through its research was already finding areas in which, hey, we can maybe be able to target this virus and find an effective way of treatment and also vaccines. Talk about that role that UTMB Health had.
Well, early UTMB recognized the real possibility that this could become a global pandemic and began immediately thinking about how do we help prepare to fight this through vaccine development. We, through our research arm, was able to identify the various types of the COVID virus and was able to then come up with testing to identify whether or not a vaccine would be effective or not. That's called developing neutralizing antibodies. And it was our neutralizing antibody test that we developed that helped us partner with the major makers of vaccines, Pfizer and others, to really bring a vaccine to the forefront much faster than has ever been done in the history of science for this particular pandemic. So we were crucial in that particular piece. We also, for the great state of Texas, were able to rapidly develop accurate testing. And UTMB helped to deploy testing in a very rapid rate so that we can identify individuals that are affected by COVID and get them into treatment.
Exciting stuff all the way around, but that's not the first time UTMB's been called upon when we've been facing a health threat. And it carries on a tradition that's been going on for 100 plus years. Just talk about how that legacy plays a role in what happens today.
Well, as you know, we celebrated our 130th anniversary. UTMB has been very excited to be one of the oldest medical schools in the country and the oldest medical school in the state of Texas. We've been doing this, taking care of patients, training medical students, developing new and innovative research for well over 130 years.
And in fact, we had a great celebration, and as folks are watching right now, some of that is the highlight of recognizing some of the legends. That was postponed a few years because of COVID, but we finally got everyone together in one room and to be able to recognize the great achievements. What was that like of sitting there at your head table and looking out at just how many folks had made so many differences to people's healthcare for so many years?
Well, that was great because, as you know, we think of ourselves as a family here at UTMB, and a family that's dedicated to the three missions of educating the next generation of the workforce, coming up with new innovative ways of caring for populations and scientific discoveries, and then providing that care in a way that has meaning. And so seeing all those individuals that work so hard to make UTMB the great institution that it is was heartwarming. It's like seeing your family come together in the great work that it does, and allowed us to come together to celebrate, but also to be thankful for all the people who've gone before us and the current people that make up the UTMB family, all almost 14,000 employees strong.
I was about to say it's a very big family at 13,925 employees throughout the state of Texas. A lot of them on the main campuses of Galveston, Brazoria, and Harris counties that you're able to operate out of, plus the clinics that are all over the state as well. Let's go to the education side. Exciting news. I mean, enrollments increased by a great amount since 2012. It's over 3,800, almost 4,000 students, and around 1,200 of those graduating from medical school. Talk about the educational aspect of, as you look back at, there was some exciting news on the education front as well for UTMB Health.
Well, as you mentioned, we had an increase in enrollment over 27% since 2012. And we're getting them through the educational system so that they can go out and be part of the healthcare workforce that's so needed across the state of Texas. We had a big event celebrating our relationship with the John Seeley Foundation, the Seeley Smith Foundation, by naming our School of Medicine the John Seeley School of Medicine after the founder of that great foundation, and honor their family legacy. And it also recognized the billionth dollar, that's billion with a B, that they have contributed to this institution to allow the work that we do to really provide quality care to the citizens of Texas and Galveston County.
Yeah.
In addition to that, we launched our School of Public and Population Health. Can't be more timely given the pandemic and the recognition that we need more public health workers to address the healthcare needs of the community, as well as our academic emergency medicine program that was set up. And we're waiting to hear with bated breath whether or not we'll be able to have a new emergency medicine residency program at UT. Something that, again, allows us to provide the care that we do so well for the citizens of Galveston County and Texas as a whole.
And so now we're up to 5 different schools that are under the UTMB Health umbrella, hoping to add some more along the way. But we should take a look. And of course, obviously, as I point out to many folks, I'm a little bit biased when it comes to the School of Nursing, since my aunt is a professor over there. And by the way, one of those living legends that was honored, Dr. Cheyenne Mouton, this past October. But again, the online master's program for the nursing department ranked 15th in the nation by U.S. News and World Report. So a big part of what has been the medical school for so long, the School of Nursing, really achieving greatness all along as well.
Well, the nursing school likes to remind us that they're actually the oldest school on UTMB's campus.
Right.
They actually beat the John Seeley School of Medicine by 1 year. So we appreciate the great legacy and the work that our nursing faculty do, and obviously the nursing workforce is such an important part of what we're able to do in terms of healthcare delivery.
And then when we talk about healthcare delivery, it goes right into the fact that you've got 6 full-service hospitals on 4 different campuses throughout. 5 of those for the general public. The one is the prison hospital, the state contracts with you on. And there's a lot of changes happening there, is being able to, I know the Clear Lake hospital was now a level 3 trauma center, but it's capable to go to level 2 at any given time. League City also working on upgrading its emergency level as well. And obviously Galveston being a level 1 trauma center, one of the few in our region, which that's always there. But there's been some changes in growth and happening within the hospital structures as well.
Right. Right now with our network of hospitals across Galveston and Brazoria County, we actually cover all 4 levels of trauma care, from 1 here in Galveston Island at our Jenny Seeley Hospital to soon to be 2 in Clear Lake. level 3 in League City, and level 4 in Angleton Danbury. So those hospitals are important pillars of healthcare for the community. It provides access to much needed care on both an emergency basis, but as a urgent and routine basis. So it again allows us to deliver on those missions. In addition to the traumas, we have pediatric emergency room, 24-hour neurosurgery coverage, chest pain accreditation at the Clear Lake campus. We have, as you already mentioned, over 100 outpatient clinics, seeing over 1.5 million outpatient encounters, over 6,000 deliveries. And with the advent of technology, we're seeing over 130,000 telemedicine visits, because we want to make sure that we give access to care for all the people in our area, that we being part of our important mission of patient care.
Yeah, telemedicine is exciting to see. I'm as I point out to folks, I'm also a patient of UTMB Health, and almost all of my visits nowadays, unless it's something really serious, are done by telemedicine. And it's convenient for the patient. I can tell you that much, and as well as it helps out on timing for you not having to wait as long to get that. But to see, particularly in an institution like UTMB Health, which in many ways was at the forefront of telemedicine. I mean, before anyone really knew what telemedicine was, UTMB Health was already doing it in ways that not thought, including being able to treat people from one side of the world to the other, and to evaluate them from the early days before we even really blinked to know what the internet was. So just that legacy to carry on, that of the emerging technology at one point is now more commonplace among what's part of the continuum of care that comes from UTMB.
Well, UTMB will always embrace technology when it helps the care of patients. And you mentioned, you're right, we were early on utilizing telemedicine, as I don't know if your listeners know that we provide medical coverage for the polar expedition. So that's the ultimate in telemedicine. I guess if once we have a base on the moon and we provide care for them, that might be a little bit further. But because we also have an aerospace medicine program.
Right.
So we're covering from the polar ice caps to outer space. And so we had to embrace technology to deliver that care. And so we took that because of, what we knew how to do, and began to utilize it to, again, enhance our quality and enhance what we're able to do for our patients. And that's why our telemedicine program was ready during the pandemic to take off and really allow us to continue to meet our clinical mission across our catchment area.
And we talked about COVID at the beginning, but we need to point out that the health system, UTMB Health, was recognized with a special award, I should say, for its COVID clinical innovation from America's Essential Hospitals, the 2022 Gage Award. Talk about that and what that meant of what we talked about at the beginning of how UTMB Health on the forefront, not only of trying to find a vaccine, finding ways to do better testing, and also at the same time find better treatment methods. Just talk about how that all played into receiving this award.
Well, I think what it represents is that the work we're doing at UTMB really speaks to leading the way in terms of providing great care. For your listeners and viewers who may not know, the America's Essential Hospitals really make up all of the hospitals that provide critical access coverage across this country, including many of the academic medical centers. And for us to win that award really highlights UTMB's leadership and showing the rest of the country how to provide care in a fashion that addresses the acuteness of the emergency.
And as we obviously you had come to this post, there was a change in leadership. That's always a challenge there for that. But how do you think overall the system has responded to just keep chugging along and keep working toward the goals of keeping everyone healthy and keeping everyone safe since you had come in as interim president?
Well, UTMB has a history. So in the 1900 storm, we got a telegram that reminded us that University of Texas and as University of Texas Medical Branch stops from those storms. So although we had a change in leadership, UTMB had a great strategic vision. We knew where we were going, and we continue to move forward. We continue to follow that vision. I think the staff and students are all resilient and know what we need to do to accomplish our mission. And we'll continue to pursue that because our mission is so vitally important to apply innovative, cutting-edge research, educational innovation, and outstanding clinical care to serve the patients of Texas.
Well, and that's a key part of this is, as you said, stops from no storm and keeps moving along. You get to an institution like this when you have the plan in place, it will take care of itself because the workforce believes in that. We're going to take a quick break. When we come back, we're going to talk to Dr. Mouton about looking ahead to 2023. You're watching UTMB Health Care Unmasked.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
Welcome back to Health Care Unmasked, presented by UTMB Health here on I-45 Now and Galveston Now. I'm TJ Alt, along with interim UTMB Health President, Dr. Charles Mouton. And Dr. Mouton, as we look ahead to 2023, what do you see as the pillars of how the institution is going to move forward in this new year?
Well, I think we're going to absolutely continue our strategic growth along the educational mission, looking at increasing enrollment in key programs and expanding, the program offerings, looking to innovate in education. So we have some exciting things. I don't want to let the cat out of the bag just yet, but we have some exciting things coming in our educational programs. In addition to that, we are like I mentioned earlier, we're knocking on wood, waiting with bated breath, whatever you want to say, for our emergency medicine residency program to receive its initial accreditation from its accrediting body. We're also looking to our research enterprise to do a couple things that were important. So when we recognize what we were doing with research, particularly in this pandemic, we had an outstanding vaccine development institute that was doing research on developing a vaccine. But we also recognized there was an opportunity for us to increase what we do in terms of therapeutic drugs, being able to treat diseases once they have them, as opposed to vaccines designed to prevent diseases. So what we did was we launched a Drug Discovery Institute that has already received federal funding to help support it, as well as foundational support from our Celia and Smith friends, to allow us to begin now to develop therapeutic drugs to address the pandemic challenges and other diseases that impact our patients. We also recognize that this is the decade of the brain and the importance of brain health. We have several researchers that do outstanding work around a host of different neurological diseases and conditions, everything from addiction to traumatic brain injury to neurodegenerative diseases like Alzheimer's and Parkinson's. So we wanted to bring them together around a collaborative research effort around brain health. We are embarking on launching a Brain Health Institute, which we hope will gain a lot of momentum, both with our philanthropic friends, but also with external funding. We obviously will continue to recruit a host of new providers, trying to bring fresh talent to our UTMB family, making sure we have the best and brightest to allow us to meet our missions. We'll continue to recruit clinicians, teachers, researchers to do so. On our mainland campuses, we're going to be expanding there as well. Our League City campus, we expect to have 24/7 neurology coverage, as well as having a primary stroke certification. We anticipate that coming by the end of this month, actually. On our Clear Lake campus, as you heard me mention, and you said, we're pursuing our level 2 trauma designation. We're going to be expanding our pediatric and obstetrics offerings on that campus as well. And of course, as all Texans are looking forward to the legislative session, we're looking to have our friends in the state legislature look to UTMB as an important investment that the state can make.
Yeah, and that will be a challenge when the legislature convenes in January there, and you're going to be, well, really one of the faces is just a new position in that former state representative Mays Mouton will be sworn in as the new state senator for the area, and replacing him will be Terry Goodman as the state representative representing the south end of Galveston County. But you have an old friend, and by the way, I should point out, a UTMB graduate, as well as his wife is too, we should point out, is Dr. Greg Bonin, and he'll be in a more powerful position there too. I'm sure you've already been building up on those relationships with those folks. I know that Dr. Bonin and his wife are both being very proud of being graduates of UTMB Health, and I know you've already been cultivating those relationships with them.
Right, and we're so proud of Dr. Bonin and the work he's done, both as a physician as well as a public servant. And so it's important for us to highlight the great work he's done, and we try to do so every time I get a chance to shake his hand or pat him on the back and thank him for what he's been able to do. I think that we look forward to the legislative session because I think we have a great story about UTMB. And I know that all our friends in the legislature, including our representatives from this region, understand the importance of UTMB, the history and legacy of what we've been able to do, but also what we're preparing to do in the future. And so I think that in this legislative session, I look forward to being able to talk about our school of population and public health and what it's going to do for education, what we're going to be able to do with our Drug Discovery Institute that I've already mentioned, but also make sure that they recognize the importance of what they've already done in terms of our mission-specific funding and the health-related formula funding that allows us to continue to meet our mission of providing care for the great people of the state of Texas, but also training that next generation of healthcare providers in a research-informed environment.
And I guess a big thing too is that since one of the things is UTMB becomes the stopgap in many of the smaller communities in our region, and as you spread out beyond our immediate region, you'll find a UTMB clinic like in deep in East Texas, for example, and the like along the way, is making sure that those smaller communities, those rural communities, are taken care of. And in a lot of cases, that does fall onto the state legislature to make sure there's funding and staffing at all those locations, correct?
Right, and I think that, UTMB has had a record for, again, over 130 years of making sure that all the populations have access to high quality care. The rural areas particularly, both in terms of what we do with our Area Health Education Center, allowing us to send students to those areas to learn what it means to practice in rural environments, to see that as a pathway for them to pursue their careers. Our regional women's and children's health clinics that allow us to bring top cutting edge obstetrical care to those regions and making sure that those mothers are cared for once they deliver, and trying to do more and more to provide subspecialty as well as primary care to regions that are historically underserved. We see that as an important part of our mission, as an important part of our role, making sure that we're able to have a UTMB physician everywhere over the state of Texas, someone we've trained, someone who can partner with those communities to make sure that they have outstanding high quality care.
Well, there's a lot ahead in 2023 to get ready for, and a lot to look back on in 2022 for you here to enjoy. But also, I wanted to take a time here, as I said, it's our first time on the show with us here. You and I have seen each other around, obviously, on a regular basis on stuff, not so much during COVID, in which you were having to make sure the institution kept on the tracks during that time as well. But let's find out, for those that may not know you too well in the community, tell us a little bit about yourself.
Ooh, you want to know about me? I'm not that interesting.
I don't know.
I'll start in the beginning. Born and raised in New Orleans, Louisiana. I wound up leaving to go to college on the East Coast at Washington, D.C. I was an engineering undergrad major, and I continued there for my medical education. I did my residency training just outside of D.C. in Maryland. I trained in family medicine and decided to concentrate in geriatrics. And so I did a fellowship in geriatrics back in DC at George Washington. I recognized when I was a resident that I enjoyed interacting and teaching students. So I decided to pursue a career in academic medicine. And so after my fellowship, I worked in New Jersey at a brand new department of family medicine in Rutgers, New Jersey Medical School. Then got recruited to Texas from there, came to San Antonio, and was in San Antonio for a good while. My alma mater came calling. They kept telling me I was doing all these great things for these institutions. I need to give back to my alma mater. And so I went back to Howard as the chair of the Department of Family and Community Medicine there. Again, was happy there when one of my fellow chairs asked me, would I be willing to help his alma mater, which was Meharry Medical College in Nashville. And I said, okay, I'll take a look at it. And so they recruited me to be dean and senior vice president of Meharry. And then I partnered with Vanderbilt and had a faculty positions there. Subsequently, my partner said, look, we're here in Nashville, but I want to be near water. And so the place that I thought had the most water was an island like Galveston. So I wound up coming down to Galveston and have been here ever since. Been here now going on 6 years. It's been a wonderful place. I really chose UTMB because of the fact that out of all 157 schools of medicine across this country, UTMB was one of the campuses that was willing to innovate in medical education to address the needs of the future physicians. And I thought that willingness to innovate, both educationally, research-wise, to make sure that patients are cared for, spoke to some of my core values. I do medical education because, my original passion was caring for people and making sure they had high quality care, particularly the elderly. But then I recognized that while I might be able to care for, 700, 1,000, 1,500 patients in my panel, if I can educate 100, 200, 230 that understand what it means to provide high quality care, that becomes a force multiplier. And that's why I went into academics, so that I can help make sure that physicians that come out have a commitment to high quality and care that provides services to the population that they serve.
Yeah, and that's that special passion that goes for that. And you've been around, and also, something about being around in different places, you can see how other institutions handle themselves, take the best parts of those and bring them with you here. And I know that your timing was 6 years ago was I'm not sure when you got here 6 years ago you thought you'd be sitting in the office you're in right now at this point, but the mission still goes as you plan.
Yeah, I told the person that hired me originally, I feel like I was set up. They had a plan that they didn't really reveal to me. It's fine. I took this position. I took the position I took because I see myself as being a servant leader to the the people that work at UTMB.
Right.
So my job is to understand their needs and to make a path forward for them to do their job better, which allows all the good things to flow.
Now, you grew up in New Orleans,
Little bit more.
and did I say it right? I always concern myself in saying it right
New
around
Orleans.
New Orleans. Yeah. Got to make sure I say it right for that. So, does that make you a Tulane guy or an LSU guy?
Oh, see, now you're starting to step on toes. So I have a disclaimer. So I have to go with both. So I
There you
grew
go.
up, my part of the city. I grew up probably just a mile from Tulane's campus,
Right.
if that much. I rode my bike to Tulane's campus all the time.
Yeah.
But I can't ignore LSU because my partner now works for LSU. She's a vice chancellor for academic affairs in New Orleans at LSU. So I have to embrace both LSU and Tulane.
And while not always directly connected to Austin, as the Longhorns go to the SEC, LSU becomes a rival now. So now you're going to have to wear 3 hats maybe sometimes.
Well, I'll have a Longhorn hat that's orange, and I'll have a split LSU Tulane.
There you go.
half purple and gold, shirt.
Well, I'd be remiss not to point out how great the medical Tulane Medical is, by the way, as somebody who actually has visited that medical center myself a couple of times, once as a patient, once as just on a tour. Great institution over there. Now I want to get into a little fun bit as we close out this here. I want to bring up mine here because I brought out my bow tie here. And I brought this up to the staff when we were going to be talking about this, because that's, it's kind of the first thing that enters the room with you is that bow tie. I mean, your smile is great, and all, but you come in with that bow tie. What brought that on for you? Was that an always thing, or is it at some point you decided that was a style thing? We're talking about it. We're showing some photos here for those watching now.
Well, I don't know if it airs at dinner time. So if it doesn't air at dinner time, I'll tell the story.
Okay.
Even in high school, we had to wear ties. So, we would do crazy stuff with ties and bow ties, but that's not really why I wear bow ties. I started wearing bow ties when I was in training as a family medicine resident. And back then, we had to do something called a flexible sigmoidoscopy. So that's where we would look, and it was a tube that we would run in your rectum to look for cancerous polyps in the rectum. Now, since that time, we don't do that anymore, but I had training with that particular instrument because that was part of our training. And so when I went to do my rotation, I noticed that most attendings had bow ties. I had a long tie. I didn't understand why. And so when you would do this procedure, you'd have like a little sort of ascot kind of like a barber smock that we would wear. And then you would do the procedure. And so when you're doing the procedure, as I was doing it, I noticed that, the person would be having a little
right. I think we know where that's going. Right. Yeah. Right.
And then I looked down, and my long tie was sitting in the pool of excrement.
Yeah.
And it dawned on me why they wore bow ties. I have been wearing bow ties ever since.
Well, that's the most unusual story I've ever had on to ask you that question there on those. But now let me ask though, are they pre-made? I mean, mine I have to have pre-done.
All right. So
or you actually tie yours.
Have a true bow tie. So here, and I'll show you. You got to have it. You got to be able to flip it. You got to be able to tie it. It's the simplest thing in the world. I don't know why people are fascinated. It's just like tying your shoelace on yourself. And then it's done. Everything else is done.
Yeah. You made it a lot easier than I do with that there. Well, thanks for playing along with us on that. I just, as I say, and Stephen Hadley, who's in the communications department at UTMB Health, he and I both worked together, worked for the same boss, the legendary Heber Taylor, who was our editor at the Galveston County Daily News for many years. And that was always his style. And always liked it as well. In fact, on his retirement, we all wore our bow ties, including that's the one I've got right here. But mine's already pre-tied, and I just loop it around my neck.
We're gonna have to work with you.
We'll have to work. I will.
We'll have to
I'll
work
tell you
with
what, Dr. Mouton, that'll be one of your educational goals. We'll have a centers of an institute of excellence for bow tie tying or something like that.
Yeah,
there.
yes,
So,
we got to do that. No self-respecting bow tie man is gonna. You got to be able to self-tie your bow tie.
well, thanks for playing along with me on that, and thanks for coming on. And a lot of exciting things. And as I tell folks, is not only is UTMB a big supporter of I-45 now, and we appreciate that, but you know, I know myself personally. My wife and I are patients there, and we know it's great. We go on my chart to set up an appointment or review things, and we always know we're in safe hands with UTMB Health. That wasn't always the recommendation many years ago. That's changed over the years, where it is a Center for Health Excellence and Healthcare Excellence, I should say. And you'd be proud that you're at the helm right now as we go off into 2023.
Well, thank you for being patient, and we look forward to continuing delivering high quality care to you and all that seek care through our doors at UTMB.
Dr. Charles Mouton, interim president at UTMB Health, on with us here today. Our show, as we take a look back at the best of Health Care Unmasked in 2022, continues right after this.
UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women.
And welcome back to our special edition of UTMB Health Care Unmasked, as we take a look back at the year in review of 2022 and looking forward to 2023. We again appreciate Dr. Charles Mouton being on with us. First time he's had a chance to join us as a full guest on the show, and we're glad to have him on. A lot of changes happening at UTMB right now, but one of the big things you heard Dr. Mouton talk about was the naming of the John Seeley School of Medicine at UTMB Health. That happened in March of this year, and we thought we'd take a little bit of time to head on back and take a look at of how special of a day that was on that March 10th.
They will in turn make us proud as they go forward, teach, heal, and change the world. What a tremendous story of vision and action. It's one thing to be a visionary, but it's another thing to translate vision into action. And that is what the Seeley Smith Foundation has been able to do with UTMB.
There's a lot of rich history in Texas and at the University of Texas system, but there really is nothing like this. The first medical school in Texas, first west of the Mississippi, 100-year partnership with the Seeley family and the Seeley and Smith Foundation. This is an incredible success story for Texas and for the UT system. And the fact that it is so strong today and such a significant investment by the Seeley and Smith Foundation means that in the next 100 years, other people will be celebrating the continued heritage, but also the great impact it has on Texas.
And we're proud to be a big part of that day as well. And a special tribute to the Seeley Smith Foundation. The vision they had, $1 billion, you heard Dr. Mouton talk about it, in contributions just to UTMB Health by the Seeley Smith Foundation. And that was what it was set out to do. And it's made a big part of that. When we come back, we'll take a look at some of the highlights of some of our favorite programs we had the year, some of your favorite programs as well, as we've pulled some of those out of some of the highlights from those shows. And we'll have that for you after this special message from UTMB Health.
Hello and happy holidays. There really is no better time to tell you how much you and the remarkable work you do and support you provide are appreciated. You're the reason UTMB has the honor and privilege of changing and saving lives in the communities we serve. 2022 was another challenging year in terms of COVID and now flu and RSV. But it was also a year of great progress for UTMB. We saw continued growth in our enrollment and welcomed new faculty and staff to the UTMB family. We graduated nearly 1,200 students who are now part of the healthcare workforce. We celebrated the naming of the John Seeley School of Medicine in recognition of the Seeley and Smith Foundation Centennial and its more than $1 billion in giving to UTMB. We launched a new School of Public and Population Health and a new Drug Discovery Institute. Our scientists attracted a record amount of research funding and continue to discover new ways to improve health. And we were there for hundreds of thousands of patients and their families in need of best care. With each new milestone or challenge, UTMB responded efficiently and effectively thanks to our university family. Every one of you played a part in all we accomplished in 2022. Your dedication and commitment to excellence this year helped us to become an even more integral and trusted part of our community. And you will continue to bring good to our communities throughout 2023. So thank you again to our faculty, staff, and students, and to our alumni, donors, and other friends, all of whom make up our dedicated UTMB family. No matter what or how you celebrate, or if you don't celebrate at all, may this season be one of peace, joy, contentment, and love for you and yours. Thank you.
And welcome back to Health Care Unmasked. I'm TJ Galt. Special edition of the show today. You've heard us talk about in the intro with Dr. Mouton about the new School of Public and Population Health. Public health is taking, COVID really exposed some areas that was found wanting in public health and response in public health, not just on when there's a pandemic going place, but in the areas where pockets of the population were not getting the health care that they needed. And so the UTMB has launched the new School of Public and Population Health. And we had a chance back in May to sit down with all the principals of that, and also two of the students who are taking part in that. And it was a special show, a lot of response to this, because we're not just talking about the medical health providing side. It also talks about those support groups that are not needing for medical degrees. So you have the doctors, you have the nurses, then you also have the strategists and a lot more people involved with that. And it was great to have everyone on board to really get a deep dive into that. And this is one of the highlights from that show. Talk about public health. There's been more interest drawn to that. Obviously, folks got more involved in paying attention to public health issues in many ways with COVID coming in there. But as you said early on, the demand in this area was already coming long before COVID when we talk about things and how that stretches through. So when you found that the Board of Regents were interested in that and said, yes, we need to have another school, why is the school itself important for the overall public health of the communities that UTMB Health will serve, both the student population and out in the public itself?
Sure. So in terms of, again, our Texas population is growing, and also the aging population is growing. So with that rise of many chronic conditions, and public health research and practice promotes both disease and injury prevention, healthy lifestyles, living conditions, and healthy environments. We also respond to outbreaks. So having a school of public health, or another school of public health, will provide the structure to continue our focus on health and health-related conditions that plague our population, including many chronic conditions impacting our population in Texas. And also, as we mentioned before, training that public health workforce is critical to meet the needs of these 30 million people.
And one of the things for folks to understand about public health, when we talk about that, yes, there is the healthcare provision of that. But really, when you talk about public health, particularly, that's why it's important to have the title Public and Population Health is that you're looking at a whole more than it is just hey, this is how you treat this ailment, correct? I mean, as we're seeing this graphic here, there's a whole lot more of context that needs to go in when you're talking about public health.
Yes. And one of the things we talk about public health is what we do as a society to assure the conditions in which people can be healthy, but also with population health is an opportunity for healthcare systems, agencies, and organizations to work together to improve the health outcomes of the communities they serve. So you think of public health as more about what we're doing as a society, and population health is more about what a system is doing for their community. So both are important.
So in talking on that topic, because obviously if you have the idea is to get more folks into the workforce, and now Care we'll bring in, because that's what you really focus a lot on there, because as we see what I would call the diversification of the healthcare workforce in many ways here, one of the things the pandemic also showed is how many areas of what I would call support for the medical side was just found to be wanting across the nation here. Can you talk about what opportunities are going to be available for people when they go to this school and then come out and then go into the workforce?
Absolutely. And we have a pretty diverse student population. We have medical residents, we have medical students, PhD students, traditional MPH, which is a Master of Public Health students. And so some of the opportunities that are available are in governmental public health. So when I started in public health 20 years ago, that was kind of what we were trained for, is we were trained to go into a local or state health department. That has expanded. And now we have more graduates of public health that are going into health systems and hospitals than any other field. And part of that too is training healthcare workers in public health. So we're all much more familiar with epidemiology now with COVID. And so that is a big area where we need to hire more epidemiologists. There are also opportunities in environmental health, occupational health, to do advocacy work to improve public and population health policy. And as I mentioned on the healthcare side, we have physicians and nurses who are interested in getting public health training so that they can do their jobs, but looking at it from a public health lens, which we think is really important too, to have more people in the healthcare industry that are seeing things from that public health lens.
Out on the road. And we are excited. First for this show is we now have two of the students who are joining us now, who are in this program at UTMB School of Public and Population Health. First up is Dr. Martina Michael, who's a master's in public health studies, and then Robert Rodriguez, who is a PhD student in the program and already worked on the administrative side of things at Shriners Children's. So Robert and Martina, thanks for joining us here today to talk about this. And let me start with you, Martina, is that, you were sharing with us before in our pre-interview, which we always do for these, is that you already are a physician. You were from India, and then you came here to study this. But tell us about what drew you to this program and why public health versus just going into studies of primary care here in the U.S.
First off, thank you for this opportunity. I really, really appreciate it. It's very nice that students can talk about our perspective. And to your question, so usually primary care is a gatekeeping sort of aspect to healthcare. We usually work as gatekeepers to the different aspects of the healthcare system. But when we do that, we can either give patients their prescription and their pills for their conditions that are acute or chronic, or we can advise them to go see a specialist. We don't really connect them, or we don't really know of what are the different social, environmental, and community determinants of health that the patient faces once they leave the hospital or the clinic. So this was one of the reasons that I, as a primary care physician back in India, wanted to know about the different aspects of public health that affect a patient and the consequences that they have to face. And it's not really a direct flow of events. Like there are different factors that come into play, and we usually don't know these things. And in medical school, we learn medicine. But in public health, we're able to integrate and have a more personal and individualistic approach. We learn about communities, but we also know what affects one individual at a time.
I to put it up in a short, would it say it just makes you a better doctor?
Yes, it makes me a better primary care physician for sure.
Yeah, because you're understanding that patient from a whole, and you're taught from the start to look for things. Now, Robert, you're studying for your PhD in the program here. You're already working in the medical field as well, but from a different side, not from the medical side, but more the administrative side. Talk about what your experience has been and why you were drawn to this program.
Absolutely, and thank you very much for having us here with you this morning. I think my journey began to the field of public health when I started my career at Shriners Children's Texas as a clinical research coordinator. And being immersed into that world as a 23-year-old, it was such an amazing experience to see and to be in an environment that was very interprofessional based. And there was such a multidisciplinary approach to the patient healthcare and healthcare experience. And as I continued maturing and evolving in that field, I was trying to understand, where can I become a more proficient individual in the healthcare setting? How can I better serve not just the patient, but even my faculty? And so I explored the field of public health in the year 2017, and to my surprise, never really knowing much about public health, it was very much the same setting that I found in the healthcare industry: interprofessional, multidisciplinary, and that just really empowered me to want to pursue a higher education in public health and to explore what other avenues in this new field I can grow in as an individual.
One of the things I think we can talk more about on this now is, and Martina, you shared this with us in our pre-interview, was you and appreciate that diversity. That was a big draw for you to come specifically to this program at UTMB Health, did it not?
Yes, of course. The diverse environment in UTMB is pretty unique compared to different schools in Texas. When I was applying to the Master's in Public Health program, I was looking at the diversity. UT Houston has that diversity, but UTMB also has it in a different aspect that's unique, that we have a diverse student community as well, where it's not just that they come from different backgrounds, but they also have different experiences. And we have different students who are doing the MPH course at the same time. So we have MD MPH students who are training as physicians. We have aerospace residents who are training to be flight surgeons or astronauts. We have different primary care physicians like me who come from different other countries. So when we have a class and we're discussing different public health problems, we have a very multi-perspective approach, and it's a very lively discussion, and it's very rich and informative. And I feel like that is very unique to UTMB.
And one of the things you shared is the diversity that's there, as you said, not just racial, not just community based or what they're studying, but also where they came from professionally before coming into the program as well. So those discussions really diverge in different aspects of this. Talk about that some, would you?
It helps a lot, especially when we are having some kind of an assignment where we are doing public health assessment. For the spring semester, we had to do a planning and health assessment of the community. And we had multiple views. Like as a primary care physician, I was more into health. But as people were coming from kinesiology, arts, and dentistry, they were more into oral health and they were more into mental health. And some of them brought in perspectives which were very new. So we had different approaches that we could add to the planning and health assessment. It wasn't just medical. Like, we were looking at the different aspects of the individual as such. What is their home income like? What is their home environment like? What access do they have? Do they have access to healthcare? Do they not have access to the basic necessities of an individual? And how can we help them? What are the small stepping stones that we can place so that they have a decrease in disparity, and we can increase more equity for these individuals in the Galveston community?
Again, a fun show. We had a lot of elements in that, and talking about the School of Public and Population Health at UTMB, a new medical school at UTMB Health, and really one that's going to be leading the way for a lot of how healthcare is treated in the country around. So it's already filling a need that's going to be big. Now, you heard in that show a discussion about the aerospace residency program. We also had a special show on that. And it's been around, by the way, for 30 years, but is now moving beyond just the thing for just direct astronauts as commercial space emerges out there. And more folks of all walks of life are having access to go into space. And as we look ahead to the future as well of how that's going to be on. And of course, in September, we did a program on this, and we had Dr. Ronak Shah, who heads up the program with us, and also Dr. Natasha Cho, who is a graduate of that program, who is a flight surgeon now for NASA. And she actually spoke with us from Russia, where she was working with the U.S. astronauts there, who are going to be going up on a Soyuz to the International Space Station. It was a fascinating subject, and one we thought we'd also share with you. It was very popular, and folks were starting to realize that they could have a future in being space doctors, in something that is just, it was an exciting subject for me too. You can hear that excitement as I talk about that. So, for folks that may not understand, but what is the aerospace medicine residency program as it is at UTMB Health?
Well, first of all, thank you for having me on the show. Certainly appreciate the opportunity. Aerospace medicine is a field that has gone relatively unknown for a long time, naturally because there was a limited market for people who needed us. But as you can take a look in the country and the nation, and you see the blossoming of the space industry, space is becoming gradually more accessible to more individuals. And as such, the expertise of a trained aerospace medicine expert is becoming more and more in demand. So UTMB, the University of Texas Medical Branch down in Galveston, has had a training program or a residency for physicians to become experts in this field. And next year we celebrate our 30th anniversary. So 30 years of doing this. And our job is to create physicians who will then render the care for those individuals who venture to go to the skies or to space. Really looking at aerospace as a whole covers a lot of ground. It covers some of the extreme environments in which they train, certainly general aviation, and of course, what a lot of folks get excited about is spaceflight itself. So that is really a bit of the history, and the way we've been training our physicians has been to meet the needs of the nation, and that's a strong backbone for how we operate, is meeting the needs of a nation. We had originally the Apollo program, which goes back some decades, but certainly we had the shuttle era, and then we started partnering with other countries like Russia, and we are launching our astronauts on a Soyuz rocket. And now you have commercial companies involved that have different vehicles. So as the engineering evolves, so does the nature of how we train our doctors to help meet those evolving needs.
Tell us about your path to getting into becoming a flight surgeon, and what you have to know in that capacity. I think a lot of times what people, all they know is about the quote unquote, is the astronauts used to call them the doctors on it, where the guy's sitting at the console telling them, okay, this is what you're reading, saying it's way more advanced than that nowadays, is it not?
Yeah. So what Dr. Shah had mentioned is, aerospace medicine falls under the umbrella of preventive medicine. And so it is a lot. Previously, it used to be about, we used to say you're taking relatively normal physiology, right? Really relatively normal human beings, and you're purposely putting them in an abnormal environment, right? The stressful environment of space, where there's it's a vacuum. If you don't have appropriate life support, there's a lot of radiation, there's no gravity. So all those things can wreak havoc on your system. Now with like the commercial industry really like making a surge in the space arena, it's no longer healthy astronauts and fighter pilots that you have to be clinically, capable of taking care of, but it's also folks who have what we refer to as abnormal physiology on Earth, right? People with maybe lung issues, like advanced cardiovascular issues that are normally would be selected out of a formal or professional astronaut program. But these folks now have the means financially to fly on private missions. And so it's really about you as a medical provider knowing how those medical conditions are treated on Earth, and then being able to try to predict what the risk would be for that person to fly and how to mitigate that risk, right? Like, how do we make it safe for people with kind of run-of-the-mill medical conditions that on Earth are not a big deal, but that could pose a greater risk in space? So there's a lot, as Dr. Shah mentioned, a lot of preventive medicine, but you also have to think about, where emergency medicine kind of comes in is planning for the worst case scenario. So we always hope for the best. We plan for the worst absolutely all the time and try to engineer that out of things. But you also have to be prepared to actually deal with a situation in space should it occur, obviously, because of the environment that it's in.
And not only that,
and then on top of that, go ahead.
No, go ahead. I'm sorry. We do have it. So I'd remind folks that are just joining us, Dr. Cho, sorry, I keep saying it wrong, and I will fix myself here in a little bit. He's coming to us from Russia, so there's a bit of a delay in us talking here on this. Go ahead and finish up what you were saying, man, Doctor.
I was just going to add, so what other folks may also not know is that aerospace medicine typically or traditionally has involved also getting a master's in public health, because traditionally the patients that we've taken care of have been part of a very specific population, right? So fighter pilots, astronauts, and what have you. And so a lot of that has to do with dealing not just with an individual and their medical certification to fly, but taking care of a whole astronaut corps, if you will, or an entire crew. And obviously with COVID, I think everyone has become much more familiar with the concept of public health and how things like, a virus can affect and impact the integrity of an entire mission. If your whole crew gets COVID, you're not going anywhere. So
right.
Historically, that has been why public health has also been part of aerospace medicine within preventive medicine.
Sorry. This could be an exciting area for folks when you notice what's going on after the Artemis 1 mission that was so successful. But the moon is not the final destination more. It's other space travel, and more folks who are not necessarily the fighter pilots that became astronauts and the like, and the new astronaut corps, more diverse. And you saw in a piece that we did here on I-45 Now, that our Paul Deaton, our space correspondent, had done, talking about folks with disabilities going to space. And so there's going to be more of that as it goes along. When we come back, we're going to get into the area of there was a really popular show with all of y'all, as we're going to be looking at what they call deep brain stimulation that's just changing people's lives. That are patients at UTMB Health. And we'll come back with that right after this word from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
And welcome back to this special pre-recorded edition of UTMB Health Care Unmasked. So we're taking a look at some of the highlights from this past year of our episodes. In April, we sat down with Dr. Patrick Harris and a patient of his, that's Reba Smith. And Dr. Patrick Harris is working in an area with some vendors to actually, it's inserting a device that helps with people with what's called essential tremors and folks that cannot control the tremors of the shake and that's out there. And this deep brain stimulation actually controls those tremors to the point for patients to be able to live a normal life. And you'll hear from Reba Smith, the patient here who it was so great to have her on because she talked about for more than 2 decades dealing with these tremors and how when she had this procedure done, she's now able to hold a cup of coffee, which she wasn't able to do before. So we wanted you to bring you part of that as well. A really interesting conversation about what's called deep brain stimulation. It is a surgery, as those of you who are listening here will hear, but it is used for different things. We're talking about essential tremors now. Let me get into this with you, Reba. We talked briefly about the process there, but I want to talk about your life up until then, because you were compensating along the way for the better part of, you said it got worse about 10 years ago and really progressed and changed your lifestyle, that you went from being right-handed to left-handed in this process to accommodate. But even with that, there are certain things you couldn't do left-handed. The one that I think that caught me when you said the other day is you weren't able to use your electric knife that you like to use when you're cooking or serving.
I could not even carve my turkey for Thanksgiving. Someone saw me shaking and they said, let me do it.
Yeah. It is one of those things, I think, folks take certain things we do every single day for granted. You brought into that kind of reality of when we lose even some of the simplest of things, it has a bigger effect on you than just, hey, I can't carve the turkey right now, right? Not emotionally and how you feel you're represented in public.
Well, I had to I felt like I had to hide my hands all the time so I wouldn't shake, so people wouldn't, I guess, feel sorry for me or think I had Parkinson's or whatever. But I was just embarrassed because of the shaking. So I think that was the worst thing. And, you're trying to eat in front of people and you're shaking, you can't get it to your mouth and you're dropping food all the time. That's really bothersome.
And so did you find yourself not participating in certain social activities because of your condition, or did you just try to muscle through it?
Oh no, I wouldn't hardly do anything.
And now, no, go ahead and finish up what you were saying.
Some of the most simplest things, a lot of times, anytime I went to use my hands, they would start shaking. So.
And then how did you find out about going in for the treatments first? About, hey, you said you've heard about essential tremors. How did you become aware of that to say, you know what, the problem I have is different. I need to go get this taken care of.
Well, I had been seeing Dr. Albicki for about 4 years, and when we realized that the medications didn't work, then he mentioned deep brain stimulation and mentioned me going to Baylor. And so in the meantime, in between that time that I was waiting for a call from Baylor, I went in to see my orthopedic, and they noticed that I was shaking. And they had mentioned, or I went to see the PA one day, and she mentioned to me that, did I know I had essential tremors, and, there's a cure for it. And she mentioned deep brain stimulation as well, and said Dr. Harris was coming here from Baylor and that he specialized in deep brain stimulation, and would I want her to make me an appointment. I jumped at the chance.
Just to be able to say that, get those simplest things in life back into normalcy for you. along the way. And in fact, we're going to bring up a video now that that this is something we did yesterday. You were doing a follow-up appointment. And this is, we're going to be showing, this is when the device is off. Am I right here, Reba?
Yes, we turned it off around 9 o'clock yesterday.
Yeah,
So
you turned it
that-
off before you went in there, and you can
Yes.
see in that right hand how the tremors go, and they're monitoring you the whole time. And how quickly do you notice the difference of when, we're watching you try to write right now but how quickly do you notice the difference when the device is turned off?
About 10 minutes after I noticed right away that there's a kind of a different feeling in my head. And, but then I noticed the shaking came back like 10 minutes after.
And right here, this is you after you sign your name. You're trying to draw a swirl
Yeah.
here. We're gonna show it up here. As it and by the way, and I don't want anyone to think we're doing this because I really do appreciate Ms. Smith of allowing folks to see this, because there are so many people out there that are having these same issues that can be done with. And now, and this is the technician here from the firm, the technology firm that works with UTMB Health on this. How quickly, when they turn the device back on, do you notice the tremors kind of subsiding?
Well, they go about it slowly because you don't want to just put it full on. So he does it in like shifts. And so I noticed a little bit, my head will stop shaking. My voice is controlled. And then slowly the hands quit shaking.
And is this something of, does it, and it doesn't, and one of the things too, Dr. Karras, is that it will not take any of the shaking away 100%, but it reduces it by a significant amount, correct?
That's right. I usually tell people that they should expect 80 to 90% reduction in their tremor in their hands and arms after deep brain stimulation. A lot of people also get it to really decrease the amount of head tremor and voice tremor. Ms. Smith had a great reduction in both her head and her voice tremor. But that response is a little bit more variable often, but 80 to 90% reduction in your hand tremor. And I think for most people, that is enough to get back to doing all of the things that you want to be doing again. And I have to say, as far as all people across neurosurgery with different things that I treat, people with tremor after this surgery are some of the happiest people that I get to take care of.
That goes right into what I was going to ask you. You told me on Monday when we talked about this the first time that, the biggest thing was you had to teach yourself how to write right-handed again, correct?
Yeah, it was pretty messy at first, but then it's gotten better. And I hope that it'll get back to normal the more I write.
In a little bit, you'll see her hold up the piece of paper that shows the difference of when she has the device turned on and when it's been turned off, and you can see as they're progressing here, and we'll make this video available to anyone here too to kind of get the full feel of how much the head, because we can tell just watching this here how it's changed as we're watching your response here, as you can see that progression go. Now, you talked about, Reba, you talked about how you yourself, you avoided a lot of maybe social interaction, didn't do much of anything. Now you had this, how that changed what you do out in the public life?
Oh, we go out to eat all the time, and we're going out to parties and getting together with friends and playing cards, without shaking. That's one thing. Yeah. And
Yeah,
I can
you're
do
better at cards now. You don't drop a card to give away what your hand is now, right?
Exactly.
So there's hoses, as we keep watching this, is that also used for, now this is right there. Let's just pick it up the cup, because when it was first handed over to you, you couldn't even pick it up. You knocked it over and you had to use two hands. And this is only a few minutes in of the device turning back on. and you were able to pick it up and hold it. You still had a shake, but you were able to, it calmed down enough that you were able to grab onto that. How often do you have to do these follow-ups in which, just kind of measure your progress?
Well, right now I was doing it every 2 weeks, and now I'm going to once every 2 months.
And you had this surgery done earlier this year, correct?
I done January 20th was my first surgery. And then 2 weeks later, I had the second surgery.
And for someone that may be a little worried because they saw the head contraption too, so there's the deal. This is just amazing. Now, just the progress from what it was earlier to now, even just gripping it, turning it, not fearing about dropping it, not having to use both hands. That alone is kind of the simplest example of how this is working well for you. If someone were to be a little nervous about having this procedure, what would you tell them yourself, Reba?
Oh, if they're nervous about it. I was nervous when I first started talking about it too. And when it came down to doing it, I was still nervous. In fact, I cried when Dr. Karras came in to talk to me. And it's just the end results are so worth it.
And again, thanks to Reba Smith for joining us there, and also Dr. Karras. Really, when you talk about innovation in healthcare, we see a lot of that, and that's happening in our own backyard. And that's one of the reasons we do this show, is so you can see a lot of what goes on. Folks can hear about the medical stuff that's going on, the COVID stuff, the flu, and everything else. But there's a lot going on in healthcare research, as well as treatments that are beyond anything that we were thinking of maybe even 20 years ago. And one of those is the thing we're going to talk about next when we come back, genetics medicine. UTMB Health at the forefront of that. Dr. Joseph Ray had joined us back in June, and we'll be talking with him about, in one of our segments there, about the difference that genetics medicine is making already in people's lives, when we return right after this special holiday message from UTMB Health.
Hello and happy holidays. There really is no better time to tell you how much you and the remarkable work you do and support you provide are appreciated. You're the reason UTMB has the honor and privilege of changing and saving lives in the communities we serve.
2022 was another challenging year in terms of COVID and now flu and RSV. But it was also a year of great progress for UTMB.
We saw continued growth in our enrollment and welcomed new faculty and staff to the UTMB family. We graduated nearly 1,200 students who are now part of the healthcare workforce.
We celebrated the naming of the John Seeley School of Medicine in recognition of the Seeley and Smith Foundation centennial and its more than $1 billion in giving to UTMB.
We launched a new School of Public and Population Health and a new Drug Discovery Institute. Our scientists attracted a record amount of research funding and continue to discover new ways to improve health.
And we were there for the hundreds of thousands of patients and their families in need of best care.
With each new milestone or challenge, UTMB responded efficiently and effectively, thanks to our university family. Every one of you played a part in all we accomplished in 2022.
Your dedication and commitment to excellence this year helped us to become an even more integral and trusted part of our community.
And you will no doubt continue to support our communities throughout 2023.
So thank you again to our faculty, staff, and students.
And to our alumni, donors, and other friends.
All of whom make up the dedicated UTMB family.
No matter what or how you celebrate, or if you don't celebrate at all,
may this season be one of peace,
joy,
contentment, and love for you and yours. Thank you.
And welcome back to a special edition of UTMB Health's Health Care Unmasked, as we take a look back at some of our favorite segments and some of our viewers' favorite segments that we had throughout the years. We have 12 shows we did in 2022. We had 12 in 2021, and scheduling even more fun along the way as we get to really go into in 2023, looking at a lot of the new innovative programs be coming your way. One of those innovative programs that we did a program on in June was Dr. Joseph Ray. He is the head of the UTMB genetics program. And now you hear that, and some people hear that and go, oh my gosh. But one of the things is that we're finding is already genetic medicine, we're able to pinpoint certain parts of someone's gene have already changed in therapies that are out there for children and for adults along the way. And Dr. Joseph Ray shared parts of the success stories that are already happening and what maybe many people thought many years ago was just something way off in the future, when really it's now. Dr. Ray, when we talk about genetics, folks, they'll hear about that and they'll think of all sorts of things and high science and everything else. In your world, particularly when we're talking about treatments now, what's out there treatment-wise that maybe people don't realize for some everyday treatments that are available, but also for the kind of chronic illnesses that folks have to deal with on a regular basis?
I would say when it comes to treatment, the treatments that have been around for a while are ones for our metabolic disorder, which is why the division is the Department of Medical Genetics and Metabolism. Metabolic disorders are conditions where a person has difficulty breaking down certain parts of proteins, fats, or sugar that lead to an accumulation of waste product inside their body and causes medical problems. The one that people will hear about the most or have a little bit of an idea about is called PKU, stands for phenylketonuria. And this is a test that every child that's born in the United States is tested for. And we've been testing it for many, many decades. And so there are thousands of patients out there with PKU. And the primary way that we treat it is as soon as we establish a diagnosis of the baby, we remove all the protein from their diet and we replace it with a formula that has all the different components of protein except for phenylalanine, which is the component that they can't break down. And then we put them on almost a modified vegan diet where mainly the majority of their food that they eat are foliage and fruits and other carbohydrates, and then the majority of their nutrients come from this formula. And for a long time, that was their diet for life. And we found that if we started it as a baby, then they could live a relatively normal life and have normal intelligence, whereas a baby who is not started on treatment would develop severe intellectual disability and eventually cerebral palsy and have a shortened lifespan. So that's the reason why we put it on the newborn screen. And there are hundreds of metabolic conditions. And today in Texas, we test every child that's born for about 54 metabolic conditions right at birth and intervene in that way.
And for folks that they'll hear this about screening of newborns, this has been pretty much a common practice, though, has it not? For most of these of screening, so you can know how to treat and deal with down the line.
Yeah, I mean, every child that is born gets a little heel prick, and they check that child's blood, and some of that blood is put on a little card that's provided by the Department of State of Health, and they send it off to Austin, and then there they test it for the 54 different conditions. And if it comes back positive, then they notify the pediatrician that takes care of the child, usually within the first couple of weeks of life. So by the time they get their 2-week appointment, the pediatrician will have the first set of results. And no news is good news. So if the pediatrician doesn't mention anything, then it's usually negative. But if it is positive, they usually get in touch with the parents. And it is a state mandated program. So if we can't get a hold of the parents in any shape or form, we will even go as far as like send law enforcement to the house to let them know that their child came out positive for the test. So it's a pretty big thing in Texas.
And one of the, let's talk about what's out there that you deal with, that you see within genetics used in healthcare, particularly on the treatment side of things, to give folks kind of a deeper dive into that subject now.
Sure. Some of the more common genetic conditions that people are familiar with are ones that they see on TV. So achondroplasia, which is the most common short stature condition, that particular condition people are familiar with because they can actually see them walking around out there. And really the highlight of this condition is that when the child is born, they have a gene change that reduces how the limbs grow, specifically the upper part of the limbs. So you see this fancy word up here, rhizomelic shortening. That just means that the top part of the arm and the top part of the legs are short, which leads to their overall short stature. But with this bone abnormality, they develop a number of other kind of health-related problems that need active intervention and sometimes need surgery over time. And that's really been the traditional treatment for these patients, is if they move forward with this here. If they develop extra growth in, say, their neck, they can develop extra bone growth in that area. It can clamp down on their spinal cord. And if the child moves their neck in a particular way, it can shut off the blood supply in that area and be a life-threatening issue. And so those children would need surgery. And oftentimes we check for that before they even leave the hospital to make sure that neurosurgery doesn't have to fix that before the child goes home. They can also develop changes in their hips that lead to early osteoarthritis or bowing inside their legs that require active intervention. And then oftentimes these patients undergo what we call limb lengthening surgery. So if their limbs are not long enough to say, for a female to be able to reach down and take care of her own hygiene, they would do like a limb lengthening surgery to lengthen out their arms or legs to be able to do something like that. Now, most recently, we added a therapy that came out that allowed us to change this quite drastically for the patients. So traditionally, we tried things like growth hormone for these patients, and it didn't really make a difference because the problem is not with growth hormone, but the problem is with this really complex pathway that I put up here, this RAS pathway. And there's a new drug that has come out called vosoritide that actually works in an alternate pathway that essentially shuts down this problem with the person's gene, which is called FGFR3, and it allows them to grow quite significantly. Not grow like you and I, but we've seen them grow about a foot or so extra over what their normal adult height would be, which is pretty huge in the grand scheme of things. Some of these patients that were started on this drug are now able to, this little kiddo right here is able to actually reach the pedals to be able to ride his own bike, able to put his arms above his head so that he can actually swim. There's been a number of cases out there where the parents have talked about the child being able to do normal stature things. I put some quotes up here. The child's legs are getting longer, so they're not needing surgery. My child is actually able to prefer her own female hygiene now. Can now link their hands over their head and behind their back and tie their shoes on their own. So a lot of positive things have come from this particular therapy.
If you go back and you look, you can find all of our episodes of UTMB Health Care Unmasked under our series on our page. And you want to take a look at some of these past shows in their entirety, feel free to do so. They're always up there because we had a great, it was an hour and 10 minutes that we discussed genetics medicine and how that's really changing a lot of things in medical care. And right now I want to share with you, this was not part of Healthcare Unmasked, but I thought it was a great story we did that our Paul Cater-Deaton had worked with UTMB Health on, and how, UTMB Health is always looking out for the folks that work for them, particularly in the hospital settings. And during COVID and the like, were long hours and the stress that came with it and all. One of the things that needed more concentration on was what's called mental care or mental health, emotional health, and how to take breaks and time for that. And so UTMB Health set aside its League City as well as its Galveston campus as what we call a Zen Den out there, and gives you a chance now to take a look at how that went about at the League City campus.
And behalf of all of the people that have donated and put a lot of hard labor into this space, I am officially opening the UTMB Zen Den. Yay! This is a dedicated space for our clinical staff to come and relax, kind of rejuvenate and recharge while they're on duty. They can use it before and after. And so this is our grand opening. We want to have a space for the staff to come and be able to just take a pause and spend some time to be able to do some self-care before they get back out and start to take care of our patients. Right over here we have our relaxation poster. So we've supplied the nurses and the clinical staff with all kinds of different pencils. The plan for this poster is that once it's done, we're going to have it framed and then we're going to hang it in the hospital. Certainly we have a water feature that was donated to us. Many people find the sound of water relaxing. We have a massage chair that's really amazing. The staff are really enjoying the massage chair. We have a Bluetooth speaker so staff can hook up music. We have a salt lamp. We even have yoga mats. So if any of the staff want to practice yoga, they're able to do that. And then we have some donated books that go through the practice of yoga, meditation, all the different elements in the space. We're excited to have it after COVID. I think the staff really needed a space to be able to come in and relax. UTMB has dedicated and donated the space for us. And then various leaders, physician leaders and nursing leaders across the system have donated everything else in the space.
And thanks to our Paul Cater-Deaton for putting that piece together. There's actually several pieces we do every year with UTMB Health that goes beyond Health Care Unmasked. And you want to take a look at those as well. You can find those under our UTMB Health Special Features program here on I-45 now. As we wrap up our Look Back show now, two of our more favorite guests that we are big participants with UTMB Health on its Broad Dazzle event, that supports this mobile mammography program. I am the MC for that most years now, and it's an important program. It's been around since 1999, and it's one that gets into underserved communities where women can get a mammogram, and they don't have to make the appointments to go into a doctor's office or go through all the rigor of that. And we had on two of our favorite guests, Dr. Angela Robinson and Dr. Colleen Silva, to not only talk about that program, but how things have drastically changed in women's breast cancer prevention and treatment.
What I'd like to say is that often the ability to get a mammogram is tied to if you have health insurance. And often health insurance is tied to someone's employment. So as we know, during the pandemic, there were many people that lost their jobs. There were many people that transitioned to other employment as well. There's a misconception that the uninsured are often people who are not working, but there are many people who have jobs and their jobs do not offer health insurance. So often the mobile mammography unit is used as a bridge and a gap to make sure that all populations, underserved and uninsured, and those can be two separate populations, are getting the mammography care that they need. The other thing to keep in mind is that all jobs don't necessarily offer you a sick day to go in to get your mammogram. So when we are taking the mammogram to various locations, that may be where someone can maybe just go quickly on their lunch break and then go back to their employment. So we try to make it easy for patients to get in. There are many barriers, childcare, lack of insurance, not having transportation. So we're trying to take an active role in making sure that patients have the ability to get their annual screening mammogram, which should start at the age of 40 and occur every year per the American College of Radiology and the Society of Breast Imaging.
And when we talk about the importance of starting at the age of 40, why is that kind of the magical number to start with there?
So I will say there are some differing guidelines, but the American College of Radiology and Society of Breast Imaging, We have gone back and looked at studies that were done. Some were even other countries where where half the country was getting screening mammograms and half the country was not. So they've been able to prove, and we've proven over the years, screening mammography does save lives. If you go younger than the age of 40, often the breast tissue is what we call dense, and that means that it's harder to see through. So we do not recommend getting a mammogram starting before the age of 40 unless patients have a significant family history of breast cancer. So 40 is the best age that we see now, given and it's a small dose of radiation that we are giving with the mammogram. So we don't want to, start at 15 years old, for example. We want to get, quote unquote, the best bang for the buck. So what is the age where we can start where we are possibly going to see a breast cancer? We know that breast cancer is more prevalent in older populations. But I was just with the residents and the medical students that we train, I was just discussing with them yesterday. People will ask me, how often do you see a breast cancer in someone who's getting their very first screening mammogram at the age of 40? And I would say it happens a few times every year, every year. There's someone, very first screening mammogram, they come in, get it, and unfortunately, we do see a cancer. And then at that point, that's where we tie in Dr. Silva. So then we work very closely together in all cases of breast cancer that are diagnosed at UTMB.
And Dr. Silva, it is one of those, it is that team handoff here that happens. And this is something we talked about a year ago that has really changed in battling breast cancer. Where it used to be is, okay, you went to your general doctor, then you went to go get your mammogram. And then from that, then maybe you're referred to someone else to then, oncology if you were to be tested, or to be examined some more. And then maybe you were sent over back. But now that's all changed now. There's an actual team where it's just kind of this easy handoff. And Dr. Silva, I would think that alone has probably saved a lot of lives, just making sure it's a whole care approach versus just a one at a time type step as it was for many years.
No, absolutely. I agree. So what we don't want to happen is we don't want someone to fall through the cracks. And if you're just told you had cancer and now you don't know, what am I supposed to do? And, you're trying to figure out, well, how do I find a surgeon? How do I find a chemotherapy doctor? How do I do any of that? It's overwhelming. So we do have a whole team who helps make that transition as smooth as we possibly can. Some of those women that are coming to the event tomorrow night, those are the women who help us with that. Those are our navigators. So we make sure that from the time you get your biopsy and you get the word that this is cancer, we've already put in place that you have your appointment set up to meet with your breast surgeon and go from there. The breast surgeon does end up being oftentimes the next person you see after you get the news. And then at that point, we pull in all the other people that we might need to pull in, the plastic surgeons, the medical oncologists, the radiation oncologists. But we try to help coordinate all of those visits and make it as smooth as we possibly can.
One of the things, and we were talking about this when this came up, but I wanted to explore this more, is like Stephanie Gundrum had posted that the age used to be 30 for baseline mammograms. You were talking about that, Dr. Robinson, as her comment had come up, and why that may be different. But it doesn't mean why you may not go in for your baseline mammogram at 30 as it was before, unless you have a history in your family or you're really concerned. No one's going to turn you down if you want to have a mammogram, I should point out. But there are other things that you could be doing along the way to make sure your breast health is in shape, correct?
That is correct. So we recommend the Society of Breast Imaging, American College of Radiology recommends that women are getting a clinical breast exam at least one time a year. So that could be from your family medicine physician, your OB-GYN, perhaps you see a nurse practitioner, but we are recommending that they're getting a clinical breast exam every year. Prior to the age of 40, as you just alluded to, if someone is having an abnormality in their breast, they should absolutely come in to see us. So that shouldn't be a barrier to them coming in to see us. We want to make sure that patients know we are here and we want to see you if something is abnormal. We know that from other studies, there are preventive things that we can be doing to prevent possibly getting breast cancer. So some of those things include limiting alcohol use, getting regular exercise, at least 30 minutes of exercise at least 3 times a week. And we know that smoking is also increased, is associated with an increased risk of breast cancers. So there are steps that we can each be taking just to somewhat lower our risk of breast cancer. The other thing I would like to add is if patients have a significant family history of breast cancer, so that would be if you have a first-degree relative, mother, sister, or daughter, who was diagnosed with breast cancer before the age of 40. At UTMB, we have a high-risk geneticist. That is someone who would evaluate your specific family history and see if, in addition to mammography, possibly other imaging would need to be done, would genetic testing need to be done, so on and so forth. So we're detecting breast cancers much earlier. Some of the cancers, if you look at the staging system, the higher the stage, typically the more the cancer is spread. We are finding breast cancers at stage 0 now, stage 0. So the imaging has really allowed us to find breast cancers much earlier, and the way that we go about detecting the breast cancers is much less invasive than it used to be.
And when you say stage 0, most of the time, I remember a day that anyone was diagnosed with breast cancer, you're hearing he was latter stages almost always. I mean, I'm talking within my lifetime, and now to hear you're catching it so early, you can get in there. And Dr. Silva, for you, that brings up a different approach now. It's like you catching it earlier, you're able to do so many more things now that don't interrupt lifestyle, that don't interrupt someone's looks and the likes. You can go in and effectively treat.
Yes. Oh, absolutely. When I was in training, being breast surgeon was very easy. Everybody got a mastectomy. Everybody got chemotherapy. That almost is not the story at all today. The vast majority of people are completely fine with a very simple lumpectomy. We're very focused on what we call oncoplastics these days, meaning we expect women who get early breast cancers to live these days. We don't expect them to die. We expect they're going to live. And so 10 years from now, when you look in the mirror, I don't want them to say every day, oh, I had that surgery for my breast cancer. I want it to be forgotten. And so we worked really hard to hide the scars, and we can put them in places that they are not noticeable, underneath the breast, in the armpit. We can hide them lots of places. And a lumpectomy is an outpatient procedure. You go home the same day. You go home taking Tylenol and ibuprofen. I mean, this is not a painful operation, and it's miraculous. Also, everybody got chemotherapy in the day. Now we can hone it down. We can specifically target your tumor and figure out, do you even need chemotherapy? And many women don't. So that's a great advance as well.
And I want to drive that point home, because I think a lot of folks today will think about breast cancer and they think about it in kind of the older terms. And I hate to say older terms, and because this is all within all of our lifetimes here that we are talking about that's changed. But
well, I'm old, so that's okay. But
no, we weren't going to get into anything like that, Dr. Silva. It goes into the thought of, I just had this conversation with someone the other day who said his wife was holding off a mammogram. She's 39. She's already been thinking about it, but she's going to hold off. She says, I don't have to do it till later. And I said, no, it's easy. Go in, get it done. If you find one of the mobile units, or just call it UTMB Health, you can get it done. And it says, yeah, but if something is found, I said, right. Wouldn't you rather know now? I said, and now hearing what you're saying here, Dr. Robinson, about a lot of times it's stage 0. And what you're saying, Dr. Silva, is the thought that it was that scary thing down the road, like people would compare to a dentist. I'm always going to get drilled, but that's not what's going to happen when you go now necessarily. That when you go in, you can catch it early enough. Avoid chemotherapy. Avoid reconstructive surgery. It is a simpler procedure, like you say, an in and out outpatient procedure now, and that's where things are moving to, and away from you got to get a mastectomy, because Dr. Silva, I know that in my lifetime, that was it. preventative vasectomies were not vasectomies, sorry, mastectomies, sorry, wrong part of the body. But that having that drastic surgery as a preventative measure was like the suggested route sometimes. Like, hey, because you have this history, go ahead and do that, have your breast removed. And that was a shock to the system for everyone. And that now that's not the case. And how would you weigh it? Is it, is it 50-50? Is it, 80-20? Is it the other way around? Just so people have an actual, because you say the mass majority of the cases have not.
I would say that it's about 80-20. About 80% of the patients I take care of get lumpectomies and 20% get mastectomies. And those may be people who have a genetic reason why they're going to be at much higher risk than someone else for something to return. Or unfortunately, there's someone who, when they come to us, they have maybe tumors in several different parts of their breast, or just in locations based on the size of the breast and the size of the tumor, that getting a lumpectomy is just not going to be feasible. But again, the vast majority of women, lumpectomy.
And again, thanks to Dr. Angelica Robinson and Dr. Colleen Silva there. They're always a wealth of information. And it's a reminder, too, that health care, even on cancer, it's not just isolated to October. That's the month we may focus on it, but it's something that's year round. And the continuative of care and the Centers for Excellence that's been formed at UTMB Health, it's a big part of taking stigma and the like out of breast cancer, for example, and a lot of great strides there. We thank you all for joining us for the show here today. Obviously, with so many episodes, we could have treated them all, but we're already coming up on 2 hours with this one program. We just wanted to bring up the shows that had a lot of high viewership. It had a lot of reaction from our viewers, as well as some of our own kind of personal touches along the way too. We'd like to thank again Dr. Charles Mouton, the interim president of UTMB Health, for joining us at the top of the show. This program will re-air if you're watching it on the re-air date. Obviously, you know that now. We're going to go ahead and re-air it on Christmas Day, and then again on New Year's Eve as well. So you can just rewatch and maybe get that some of the education that we've provide on the show. And that's what we're about with this. Again, if you've missed any of the episodes of Health Care Unmasked, they're under our series on our Facebook page. And you can go in there and catch those at any time. Again, thank you all. And big thanks as well to Becky Trout-Ubbenhagen, David Bethay at UTMB Health. They coordinate this program with me every month. And they really do all the heavy lifting. And they're not on the show. I need to bring them on every once in a while. And then, but both the David Bethay, an old high school classmate of mine, and and again, not doctor, but Becky Ubbenhagen. Used to sing doctors all the time on the show. Anyway, thank you again for watching. Have yourself a happy holidays, folks, and a blessed New Year.